I'm so excited. I hope you guys are excited to join us and to learn a little bit more about CMV, ending preventable stillbirth. I think between Amanda and I, we're going to have a lot to say. Amanda and I have actually been talking all day, so we're excited to talk to all of you guys about CMV. I'll share with you a little bit of my background, and then Amanda will talk to you a little bit as well. My name is Jen. I did the push takeover this week across social media accounts to educate and promote awareness of CMV and stillbirth. I lost my daughter in April of 2020. Her name was Lucy to CMV, and it was congenital, meaning it was inside my womb while I was pregnant. I didn't know that I had CMV, and we found out that she was gone at one of our routine doctor appointments. It took us about 6 weeks after that with an autopsy and additional pathology to figure out that she did in fact have CMV, and it was quite severe, which never actually showed in an ultrasound. It was also during peak COVID times, so some appointments were getting skipped or prolonged and things like that. And, you know, the whole experience just really was rough. After that, you know, I did probably what everybody does going through a traumatic experience like that. I dug in and literally read every and anything I possibly could on CMV, on stillbirth, figuring out why this happens, like how are we living in the United States and we're supposed to have this amazing healthcare. I work in health and pharma, and so I had kind of been living in that bubble, and yeah, you know, obviously going through all of the data and research, really realizing that we actually don't have that great of healthcare and advocacy for women's health and for prenatal health. And so here it brings me here with Push and with CMV and being an advocate and a champion to spread awareness. And, you know, all of my friends now that get pregnant, they know beforehand that I'm on them to get a CMV test, even while they're pregnant, to continue to get them to monitor and measure their risk. But I'm excited to talk to you guys all tonight. And here's Amanda from National CMV to share her story.
Awesome. Well, thanks for having us. Jen, first off, I talked to a lot of families. Very sorry for your loss. I mean, it's devastating what this virus does to families. And so just have to start off by saying that I wish it was a rare occurrence. It's not a rare occurrence, unfortunately. This is something that many families are dealing with. Also just want to say great job on the takeover this week. That was so fun to watch, and we couldn't even keep up with you. We were trying to put them on our stories, and we could barely keep up. So
it's hard being a fake influencer.
yeah, it is, and it was a great job. And so thank you so much for spreading awareness, and we appreciate Push, you know, spreading awareness about this issue. So a little bit about me. I'm a nurse by trade. I've actually been a public health nurse I've been in the public health space, oh gosh, trying to do the math here, for 15 years, and worked in maternal child health for several years before I had a pregnancy impacted by congenital CMV. We actually did see a very small difference on ultrasound and went for further testing. We had an amniocentesis at 21 weeks, confirmed congenital CMV, and we got experimental treatment during pregnancy. And our daughter, since we knew she was going to be born with CMV, we were able to, you know, access that experimental treatment. And then we were able, even though she looked perfectly typical when she was born, we knew she had this. They were able to really give her a thorough exam when she was born. She had symptomatic congenital CMV. She was able to get treatment. We were able to get early intervention. So actually, this was all in 2015 that this happened. And, you know, in our situation, we actually got the best available treatment at the time, both prenatally and after birth. And she is still severely impacted by congenital CMV. My daughter, Pippa, she is 6, and she, like I said, she's got symptomatic congenital CMV. She has a brain malformation, intellectual disability. She's nonverbal, issues with eating, seizures. We've got really the whole gamut of things. But she is a wonderful, fantastic child. We love her so much. She's just such a joy to have around, and it really makes you appreciate the simple things about being a parent and having kids, and really appreciating those. Any little milestone is a huge deal for us and our family. So actually, when I was pregnant with Pippa, I started working on CMV advocacy. I was shocked that I was a nurse and I didn't know about this. So this was something that the other nurses I worked with didn't know either. We did a lot of state advocacy. We passed CMV legislation in our home state, and got started volunteering with the National CMV Foundation, and then started as a staff member with National CMV a couple of years ago. So that's kind of where I'm at, where I've been. I'm currently the program director. So I do anything and everything that is needed to make our organization function. We just have a couple full-time employees, so we're just always trying to push forward and make sure that everybody knows about this. So thanks again for having us.
Of course, and thank you for all of the work that you do. And we just became friends on Instagram, and Pippa is so helpful. And I saw her walking up the slide. I was like, oh gosh, Amanda, you're gonna make me cry.
Oh.
Why do you think people don't know about CMV? Like, why do you think the awareness is so low? Because when you look at the statistics and the incidence of it, it's up there with Down syndrome, right?
Yeah.
And it's way more prevalent than toxoplasmosis, like changing cat litter. We all know about that. Like not eating sushi, we all know about that. But like, why do you think the awareness is so low?
Oh, well, I think there's a couple reasons, and this is a lot of what I say tonight. I will preface if it's my opinion. So some of this is based on my opinion here. I think one of the main problems is that, and it's not necessarily a problem, we have issues with visibility because most infants, 90% that are born with CMV, look completely typical at birth. And after that newborn period, if they start to develop any symptoms like hearing loss or developmental delay or anything like that, it is usually too late to go back and determine that CMV is the cause. So I think that that's one of the biggest issues. Even in the medical community, the doctors and nurses and healthcare workers, they learned about this probably in their schooling, but it's hard when it's so rarely identified, and when most infants look really typical. Also, like I said, we've got to make that diagnosis pretty early in life. And until we screen every baby, it's easy to think, oh, I'm not seeing that very often. The other thing is, even infants with symptoms, they're usually subtle enough that they're missed on a newborn exam. They've got intracranial calcifications in their brain. Well, you can't see that unless the infant also has a very small head size or something like that. So it's easy to miss this. So I think that it's just not on people's radars because we don't identify it that much. I think if we identified every case, it would be more obvious how common it is and how it is a problem.
Which is so crazy because so that's babies that are born, right? And then you have this whole other layer of being pregnant with CMV and not even being aware of that. Like, I got a pamphlet, I have it somewhere because I saved it because I was in my rainbow baby pregnancy. I saved it because I was like, what the heck? Like, there's like all these other things in there and what to do and what to not do and all of this stuff. And CMV was nowhere. But if you have a toddler at home, you're at an increased risk, especially if you haven't had it before. So it's like, why aren't we just screening women of childbearing age that want to get pregnant? And we actually got a question too in the chat. Italy and France do routine CMV testing. Are there other countries that do it, and why doesn't the US? So I have my own opinions on that.
So I can't tell you off the top of my head what countries do it and what countries don't. There's several countries that do it. I think Israel's one of them too. It's kind of scattered. There's a few countries in Europe that are doing it. It is not recommended by the governing body here in the United States, which is the American College of Obstetrics and Gynecologists. They do not recommend routine CMV testing for pregnant people. So that's an issue.
I'm assuming as like the CMV Foundation, you guys have talked to them, right? Like why? What is the reason?
Well,
because the only thing I've heard is, oh, well, if you have it, we can't do anything about it. So what's the point?
sure.
Which, to be perfectly frank, it feels to me like bullshit, because again, there are several other things that you can get that they do warn against and advise you on the risk factors, and even preventative testing for, that you can't do anything about. So what is it about CMV that seems to be the holdup?
Sure. I don't know that I don't know that I have an exact answer. I think one of the things is that those tests can be tricky to read. So even if you get CMV, IgG, and IgM antibodies drawn, it can be difficult. You need to go to a provider who really knows how to interpret those test results. The other thing is, sometimes people get the wrong idea that if I've had CMV before, I'm in the clear. That's not really true. Every pregnant person should take the same precautions, whether they've had CMV in the past or not, because you never know if you're going to be exposed to a new strain of the virus or something like that. So that's why we definitely have information on our website, and we encourage women to talk to their doctors about getting tested. And it's just a nice opportunity for pregnant people to have that conversation with their doctor. And go from there, and then they can make an informed decision about what precautions they want to take, if any. But our recommendation is really the same for all pregnant people, whether they've had CMV or not.
Yeah, I mean, I think that's the thing for me, right? It's like, okay, I personally think there are things you can do to help prevent once you know your risk, right? And even in utero, there are treatments available, albeit investigationally, that can be done. Again, it's like a decision, right? Why it just is so hard for me to swallow, of like, why aren't we giving women and parents the choice? We're just ignoring it and sweeping it under the rug.
Sure. Our position is definitely that any family should have access to this information, so that everybody is really starting from the same, level playing field of having access to this information. That's one of our biggest things, is that, our mission is really to prevent, pregnancy loss, childhood death, disability. And the only way to prevent it right now, unfortunately, until we get a vaccine, is behavioral modifications during the pregnancy. And it's hard to take those if you don't know about CMV. Mm-hmm. It's hard to take those if you, talk about hygiene in general, but you don't understand that there could be a very significant consequence attached. So that's really our position, is that we want people to have access to the information.
And just a heads up, everybody, on the Facebook Live, you can enter in questions. We are getting them, and I'm doing my best to try to navigate reading them and answering with Amanda at the same time. But Amanda, to kind of piggyback off of what you were just talking about, one of the things I have heard and had an interaction with this week with an OB on Instagram was that taking precautions against CMV were too burdensome and anxiety provoking for moms. And therefore, that is one of the reasons why physicians aren't proactively educating women about the potential risks. Curious what your personal opinion is on that. I'll give you my cheeky personal opinion. I mean, maybe I should have a sip of my wine first. It's National Wine Day, everybody. Just saying.
We definitely hear this a lot. We definitely hear that, we don't want to scare people. And I guess our position is, we don't want to scare anyone either. We just want to provide people with accurate information about a risk to every pregnancy, has a risk, especially if you're, working with kids or around kids. So we really take the position that people deserve to have this information, and then they can do with it what they want. The point is that they're making an informed decision. And really the research, there is research that prevention measures work. There's also research that pregnant people, and I think this study showed that most pregnant people want this information. They want the access to the information, and then they can decide what to do with it. So that's that's really where we come from.
I mean, I think that makes sense. I'm going to do a lost mom take on that is, to say it's burdensome to provide people with information, I think is so disingenuous and quite frankly gross. Like, we are not fragile. We can handle information. We can understand and make choices for ourselves. And I think it's just so patronizing to kind of have that, burdensome mentality. Because truthfully, what is burdensome is burying your dead child. That's burdensome. What's not burdensome is being like, oh, hey, maybe don't finish your kid's sandwich. I can do that. I can make that happen because I know that I'm at an increased risk, right?
Yeah.
And that's the point.
A lot of our families say that. They say, I was a rule follower my whole pregnancy. I went home after that first appointment. I read all the information in the packet that they gave me. No one ever talked about this. And I do personally think it's a travesty that the first time people are hearing about this is when there's something on ultrasound.
They're blindsided.
Your baby's brain doesn't look typical, or your baby's lost their hearing, and then you hear these words CMV that you've never heard before. And so I personally do not think that that's the first time that someone should hear those words. That's just a really a sticking point for me, and we care so much about preventing other families from going through what CMV families have gone through. And like I said, at this moment, that is hygienic precautions, unfortunately, until we have a CMV vaccine.
Yeah. We did have a quick question. Is the test just a blood test? Yes, it's literally just a blood test. And most insurance covers it, which is also the craziest thing of like, just get it. Ask your doctor for it. If they refuse, tell them you want it noted in your medical records and in your chart. I bet you they'll change their mind pretty quickly once you say that. I have been very lucky. My OB is fantastic. And even in my pregnancy after Lucy, I had CMV testing all the time. But ask for the test. Like, it's not, I personally don't think it's not going to harm you to know your information and to understand your risk.
Yeah.
We did have a couple of other questions. How many CMV babies are stillborn each year? So, Amanda, I don't know if you have like exact stats on this, but from what I've gathered, so there's roughly 24,000 stillbirths a year. CMV accounts for approximately 15% or more of them. Part of the biggest challenge is it's not documented, and in a lot of times pathology in stillbirth period isn't documented. There's no autopsies or pathology or anything like that to find out even what happens in stillbirth, which you want people to go on a warpath, go call up the push folks and talk about the fact that, the documentations of stillbirth are also insane. So that's kind of like our best guesstimate about, right? So that's about 3,600 families a year that are affected by CMV as a stillbirth.
Yeah. And I guess I would just add to that we don't have a true number. We need much, much, much more research in this area. And even the 15% that Jen is using, that's based on a few research studies, but we need so much more. And so that's a huge, huge area, and just CMV in general needs more research funding. This is a huge impact, and so we need this to be better researched. And I was going to ask you, Jen, I feel like a lot of people that have a stillbirth, due to CMV, never get that conclusive tie back to CMV. So how did you get that, and what can people ask for if they want to find out?
Honestly, mine was purely by chance. My OB was just like, throw this in with all the other tests type of thing. She had actually went to medical school, and one of her friends, was very entrenched in the CMV space. and is an OB as well. So she was just like, yeah, we'll put this in with the other test to see if we can find out what happened. A lot of times in what I've read and, my free time reading medical journals, which I would really prefer to like not do. So if like the medical community can just help a sister out. From what I've gathered, it does cause intrauterine growth restriction, which, that in and of itself is this whole category, but may not always then get attributed to CMV as the root cause of that. So that's kind of how I found out, was through the autopsy and the blood work. My placenta, in terms that my OB used me, was riddled with CMV and quite visible. So she, they knew pretty much right away what had happened. But to your point, like a lot of people don't know, or their doctors, again, don't know enough about it to even order the test after the fact.
Got it. Okay. Interesting. Good to know.
Yeah.
I see a question here, Jen, that maybe I can hop on. What states what states have CMV legislation? So I don't have my map up. So I'm not going to be able to name them all off the top of my head here. But I will say, if you go to our website and you click on advocacy, that is where you're going to find our map of CMV legislation. So far, I think we're at 13 states have passed some form of CMV legislation. Some of that is CMV education, and it could be as simple as the Department of Health has to put something on the website. It could be the healthcare providers who are taking care of a pregnant person have to provide CMV information in the first trimester. Some states have that. And then some states have newborn screening. So usually it's screening where if the infant fails their newborn hearing test, they have to be tested for CMV by 21 days of age. However, we did just have our first state pass universal CMV screening for all infants. That's Minnesota. And so we're thrilled about that. That's going to be huge. And so that's kind of where we're at with CMV advocacy. And like I said, I will definitely get that information. We will get that information out to you guys so that you can look, but it is on the advocacy page on our website.
I just popped the link into the chat. I don't know if everybody can see that, so maybe Samantha will help me out. If not, she's been helping us on the back end. We do have another question. I work at a daycare, and warning signs regarding the risks of CMV are posted on our walls. The fact that it's not mentioned in prenatal healthcare settings doesn't make any sense. I agree.
Amazing. I love that. I love that that's at a daycare, because daycare workers are at increased risk. So there is research on that. Daycare workers and women who have, or pregnant people who have children in their own home, young children. So the toddlers, they're the hot zones. So if you're dealing with drool and diapers and all that,
so many ways, they are the hot zones.
They really are. And who can blame a pregnant mama for finishing their kid's breakfast, right? You don't want to waste that food.
Picking up a Pepsi with your mouth. I mean, can I tell you, with my first daughter, it was like a thing. The Pepsi falls on the ground, you clean it with your mouth, and then you give it back to the kid. Like, it sounds gross, but we've all done it, right? And if somebody was like, hey, quick, just a heads up, probably we know that that's gross, right? But like, also, it can cause this serious impact. It's not just like, oh, you can get a cold, right? I wasn't afraid of a cold. I would be more fearful if it was like, oh shit, my kid could die or be born with severe cognitive impairments, blindness, deafness, all of these issues that can happen. For sure, that Pepsi would never have touched my mouth.
Yeah, absolutely. We don't want anyone to be stressed out or anything like that. We really want people to just take some simple precautions to reduce their risk. We're never going to completely eliminate the risk, but we'd like to reduce it.
Right. We can at least try. They're not hard things to do. They're really not. And that's, I think, we were talking about burdensome recommendations and things like that. Like, that's the thing that gets me, is it's like, we're not like asking for a lot. And to me, it's more just about being mindful and having that in the back of your head, right? We hear about, probably avoid sushi or a turkey sandwich. We have that in the back of our head. but I'm not like scared to be around a sushi roll. I can make that decision for myself if I want to go risk it, but at least I have the information and know it's not causing me severe anxiety.
Yeah, and we should add that the CDC, even the CDC says that pregnant women may be able to reduce their risk by taking these precautions. So it's not like we're, coming up with this on our own. We're not the only people that are saying that these are, good precautions to take. American Academy of Pediatrics has it in their book too, that pregnant women, or pregnant people should be, informed about these precautions that they can take to reduce the risk.
So this is where I might get myself into trouble. Why doesn't ACOG have it? Because they issued a bullet. They've only issued, I think, like 2 bulletins, correct me if I'm wrong, on CMV. One was in 1998, where they advised to educate about CMV and take precaution, right? And then they issued another one in 2015 saying, just kidding, we're going to roll that back. Just pretend it's not there. What's their deal?
I don't know.
I don't want to get you into trouble either.
I don't know. I can't really speak for them. I know that they have concerns about, causing anxiety. I know that that's one of their big concerns. The other thing is they feel like the hygienic precautions aren't always effective. So I think that they have concerns about that. We disagree, and we really feel like the hygienic precautions are worth it. They'll reduce the risk, if not eliminate the risk. And, we just really think that pregnant people deserve to have access to the information. So I can't really say why they changed that. I would just say that our position is that pregnant people deserve to have the information.
Yeah, I mean, it's 6,000 babies a year.
Yeah. And
so it's like, even if you can just help a fraction of that, why wouldn't you just do it? Like,
yeah,
it takes nothing.
And we should point out that other governing bodies from other countries take the position that pregnant people should be educated about CMV. In Canada and Australia, for example, they do state that those precautions should be given to all people who are, pregnant or planning a pregnancy. So there's differing opinion, and we certainly hope that they will revise those recommendations, but we just know what our position is.
What can we do? Like, but seriously, like, how do we gotta like go call them up? Like, I gotta at them on Instagram.
I
now that I'm an influencer.
I can't say that I have the solution. I just can say that we're really trying to make change in other ways, because we don't know that we're going to be able to get them to change that recommendation. So we're really just trying to increase awareness in other ways. So I think the best thing that people can do is make sure that they tell everyone that they know. Tell all your friends, tell everyone, especially people who are high risk, who work with kids or who have a kid in their own home, making sure that they know, and just knowing that, even if they bring it up to their doc, they might not get
a positive
I don't
response.
want to say it's not going to be accurate, but I think most of the time when people bring this up, they're pretty much told that is so rare, that's never going to happen, you don't need to worry about it. And we would just say that it's common enough that we want people to take it seriously and to take precautions if they want to. So that's what I would say is it's our job to spread the word.
So I agree, but despite the fact that the data is so broken and undocumented, right? Like, it's about 1 to 4% of all pregnancies are impacted by CMV. That's not rare. Like, that is a decent amount of pregnancies. And I've heard this as well. Obviously, me getting on all of my friends to go get their tests, and their doctors come back with the same thing. Like, why do you want that? Like, you can't do anything, even if you have it or you get it, or what are you supposed to do? And that, I feel like, is the most maddening thing to me. And probably on behalf of all of the lost moms that have had a stillbirth from CMV, that have had a baby born with CMV, that continue to have to struggle to live with it. Like it kills me. I don't get it.
It can definitely be hard as a CMV parent to feel like it's being minimized, when we know it's pretty common. I mean, 1 in 200 or 0.5%, it doesn't sound like that much. But then when you apply it to all the births, across the entire United States every year, we're talking 20,000 kids are born with CMV every year, and
Right.
1 out of 5 of those are going to have a permanent, health condition or disability due to it. So it is a lot. It's easy when someone says 0.5% to think, oh, that's really rare. But
who doesn't give a shit about rare when it's you?
When it's you, it's 100%, right? So
right.
It doesn't really matter. And I feel like we hear that sometimes a little bit with COVID too. It's like, well, it's only happening to a small percentage of people, but when you apply it to the whole population, it's a lot.
Right.
The number is huge, right?
It's a lot of people.
Yeah, it doesn't matter if it happens to you. It's 100%. So.
And then not even to mention the residual effect of it, right? I feel like, doctors operate in mass, right? They're operating in, bigger populations, right? And I mean, personally, I don't think 26,000 people is a small population, but they're operating in this kind of en masse environment, and we're operating as an individual. For them, it's a Tuesday. For us, it's like a very meaningful, traumatic experience that is just me. It's not just me that delivered a stillborn baby. It's my husband that was there. It's my daughter that says she misses her sister. It's my mother and father-in-law that wish they had that grandbaby. It's all of my friends that had also been excited. Like, it is this ripple effect that I feel like is that disconnect. And I don't know how to change that. I don't know how to make people care. I don't know how to, go bang down some doctors at ACOG's door to be like, this is not okay. Like, I don't know sometimes I just don't know what to do other than tell everybody I've ever met.
Yeah, it's really hard. And I hear you. And I feel the same way. I mean, I have a different job than I had. We live in a different house. We go to a different school. Like, we have a completely different life than we would have had if our child had not been born, severely disabled by CMV. So it's very hard, because you're right, for these docs that are, delivering, hundreds of babies a year, it's
a blip.
Yeah, it's a blip. And I think sometimes, especially because a lot of times they don't even know that they delivered a baby with CMV, because again, they looked typical. 90% of them do. More than 90% probably look typical. So it's very hard. And I think maybe sometimes when you do have that family who loses a baby, or who has a really severely symptomatic baby born with it, maybe that's something that kind of changes your outlook on it. But it is hard, because for us, you're right, it's every day. It's never going away. This is
every
forever.
single day for the rest of your life.
Yeah, I mean, our daughter will live with us. I mean, God willing, we have no plans for her to ever be independent. I mean, it is a lifelong commitment for us, all because of this. So it's huge. So someone did put in the chat, what do doctors learn about CMV in medical school? So they're going to learn about CMV. I mean, I think they're going to learn about CMV. They're going to learn the percentages. They're going to learn how common it is, how not common it is, that kind of thing. One thing that I think that sometimes happens is they will get a picture in their mind of what a child born with CMV looks like. And in their mind, it's going to be a very symptomatic baby. So it's a baby with a very small head and an enlarged abdomen, because they have an enlarged liver or spleen or something like that. They've got spots all over. They've got a blueberry muffin rash. So they might have a picture in their mind of what a symptomatic baby with CMV looks like. And so that's one thing that I think is tricky, is I think sometimes it slips under people's radar, again, because that's not what most babies born with CMV look like. Most babies
Right.
born with CMV look like every other baby. So I do think that that's one thing that they learn in medical school that maybe is a little misleading, because they have this idea that, oh, if I had a baby with symptomatic congenital CMV, I would catch it on their newborn exam. And that's not really happening.
Or even in ultrasound, right? Like it can be visible in ultrasound too.
Most of the time, I mean, we were a very rare case that they even found anything on ultrasound. So
wow.
That doesn't happen very often. So most of the time, these kiddos are not being picked up throughout the pregnancy or at birth, because most of the time they're looking typical, but you can't see everything on an ultrasound and you can't see everything on a newborn exam. So we're missing kiddos. We only identified, I think it's less than 5% of children.
Oh my God.
So until we start universally screening infants, we're not going to catch the vast majority of infants.
And then it's usually within the first year of life that symptoms start presenting themselves. Is that right?
I mean, I can't say off the top of my head that I know a percent that will for sure happen within the first year. What we can say is up to a quarter of infants born with CMV are going to end up with some consequence, but that can show up months or years later. Wow. My daughter's hearing loss, for example, didn't show up till age 3.5. So it can be a long time later.
And then if you're not tested, if the baby's not tested when the baby's born and screened for that, you can have a baby with hearing loss at 3 years old and have no idea what happened or why.
Unless your state keeps your newborn blood spot card for years, which some states do, there is no way to go back and do that testing again. That's why we really need that testing to happen right away. So most states, it's, the card is gone by then. Most states keep it for months to a couple of years. There's some states, I think it's Michigan, keeps it forever.
Wow.
So you can always go back. But even the blood spot card, I just have to throw this out there, is not completely accurate. It can still miss some cases. So I don't want people to rely on that completely. You can have a negative blood spot card for CMV and your kiddo still had CMV. It just wasn't picked up on that blood spot. So we're not at 100% accuracy for that yet.
We have another question. Do OBs learn that this can be a cause of stillbirth? I can speak from my experience in talking with my OB, who, I was her second case in her entire career with CMV and a stillbirth. She said that she did learn about it in medical school. It wasn't like a big topic. It was like a chapter, and probably rolled in with like toxoplasmosis and Zika and some other conditions as well. And I believe they are taught that it can be a cause of stillbirth, but again, that it's a very rare occurrence that could happen. But most often that the babies are born with developmental disabilities. Yeah.
So going back to what people learn in school, this is a torch infection. And so sometimes people have heard of this term torch infection. So there's a bunch of different, infections during pregnancy that spell out the word torch, and C is cytomegalovirus. So everyone learns about torch infections in medical school, in nursing school. I mean, I went back to my nursing book and found it in there, little teeny tiny paragraph about CMV, very short.
And by the way, CMV, don't worry about it, it's over here.
Yeah, like hardly anything. And so I actually went back to my nursing program and I said, hey, you guys, we need more on this. And I made them a video and they're showing it in their nursing class now. But, it's one of those things that are, not necessarily on people's radars as much as it should be, considering how common it is.
I was just going to say, it's not as common as the disease is actually common.
Right. Yeah.
I think that makes sense.
And Shane's out there. Hi, Shane. Shane's saying we ID based on hearing loss, which is less common. Yeah. So I think what Shane is saying is a lot of times our screening for newborns is contingent on a hearing loss in the newborn or a failure of the newborn hearing screen. And the vast majority of infants born with CMV will pass their newborn hearing screen. So when we rely on that hearing screen as like the first step towards getting a CMV test at birth, we miss the vast majority of infants. It's not the best way. We really advocate for universal screening. However, we support any moves toward screening more infants for CMV. Our foundation does. So we support hearing targeted screening, expanded screening, universal
All the screenings.
all the screenings.
All the screenings. Why not? Why? Somebody can please just tell me like a legitimate reason why, and don't tell me that it's because it's hard. Like I can't.
So it's hard and it's expensive, Jen. So actually, what happens with newborn screening is there's a recommended uniform screening panel, and there's a national committee that makes the recommendations to each state what they should screen for. And it's quite a lengthy, I guess, application process for that. And so you have to get medical experts together and get all sorts of research together and fill out this application and send it in. And then hopefully they'll review your condition to be added. We are in the middle of that process right now. But even after something's on that, it's called the RUSP, it is up to each state individually if they're going to add it. So some states follow it, some states do more, some states do less. Like I said, Minnesota's doing it, and they, it's not on the RUSP yet. So we're working on that.
Can you tell us a little bit about how you guys got Minnesota to do it? How we can replicate that elsewhere? Like, do I just like have to like run for governor of New Jersey or something to like make this happen?
Well, New Jersey actually just passed a law.
So I know, I just saw it.
As soon as it's on the RUSP, New Jersey will be adding it. But so I will say, I worked a lot with the Minnesota people that passed that law. It took them 5 years. They worked very hard. There's a lot of hard work involved. There's a lot of luck involved. They were not expecting to get what they got. And so they were going for a educational bill. And I don't know how they ended up with a bill that said we're going to fund a huge awareness program for millions of dollars. And we are going to have the Minnesota Newborn Screening Committee review CMV. The Minnesota Newborn Screening Committee reviewed it and decided to add it. But Minnesota funded it, so they've got funding for it. I mean, a lot of states, funding is a huge issue. So it takes a lot of work. And if people are interested in advocating for legislation in their state, I would just encourage them to reach out to us. We will connect you with the right people. We're always looking to support those efforts. So just connect with us. If info@nationalcmv.org will get to our email inbox. So.
I was secretly hoping you were going to tell me to run for governor. I wouldn't do it anyway. That's not a job I want. I'll go bang down some doors though.
Yeah. It takes a lot of tenacity.
Yeah. Like it seems like it's like slow, methodical, like constant push, if you will.
Yeah, it really is. And it depends on what state you're in. Some states are going to be able to get things done that other states just are not going to get done. Just because of their legislation, because of their climate, their finances, just what's happening in that state and at that time. You can do everything right and not have it work. And that's just the way it is. We've got people who've been working on it for, like I said, 5 years in Minnesota, and finally they got it through. So.
Wow. We have a couple of other questions. Do you want to talk a little bit about the National CMV Foundation, your mission and scope? I know you introduced yourself a little bit, but do you want to tell everybody a bit more about CMV Foundation?
Yeah, sure. So we, I might get the year wrong, so apologies to the founders who are listening. But we had several different small CMV organizations that were all kind of operating independently. And so they combined in 2014, I believe, is the year we incorporated. It might have been 2015.
Listen,
apologies.
It's almost 9 o'clock.
Lots of numbers going on in my head here. So we really got those organizations to come together with a national focus of we're going to try and move the national agenda forward. And so we updated our mission last year. Our mission used to be just to ensure that pregnant women were aware of CMV. We really have expanded that mission, and we're really purposeful. Our mission now is to prevent pregnancy loss, childhood death, and disability due to cCMV. And it was a conscious effort to put pregnancy loss in there. We really wanted people to realize this is not just impacting, infants after they're born. This is impacting, pregnancy and stillbirth and miscarriage, before an infant is born. So we really wanted to capture the fact that 400 children, infants die every year, and who knows how many, older children die just from the consequences. We don't necessarily have numbers for that. And it's a huge cause of disability. So we really wanted to capture, hopefully, the scope of it. We focus on a few different things. We have a few programs. Like I said, we only have 2 full-time staff members, so we're hoping to add more. But we work a lot on fundraising to support the mission. We fund research. We have some awesome ambassadors called Community Alliance Chairs who are working on initiatives in their area. So we're trying to get the word out. We're trying to forge strong partnerships with other like-minded agencies who really have a stake in this, like AAP, CDC, Epilepsy Foundation. There's a brain malformation called polymicrogyria that a lot of kids with CMV have. There's an organization out there that supports that, so we partner with them. A lot of hearing loss organizations we partner with, because hearing loss is the most common symptom of congenital CMV. So that was a lot, but we're just really trying to make a difference. We're trying to push the conversation forward,
and you guys are really just focused on your mission within the US, right?
We partner with other organizations. Canada has a great group. The UK has a group. There's some groups in Europe too. There's a group in Chile that's starting. So I do think it's growing worldwide. I think we're probably the largest at the current time, but there's work being done all over. And there's international interest in this. Mm-hmm. And like we've said, other countries are doing things in a different way than us, and maybe arguably a better way than the way that the US healthcare system handles this problem.
Yeah. What do you feel like is needed to better understand the connection between CMV and stillbirth?
Well, it would take more research. I mean, I think, like we talked about earlier, I mean, the problem is it rarely is tied back to CMV. So I think if someone could do more research on that, I mean, we saw you and I have both looked at the research studies that indicated around 15%, when we know that CMV is only in 1 to 4% of pregnancies. So since it's not the same percentage, we know that it's probably impacting stillbirth quite a bit. We just need more funding for research, I guess. And I think we also need stillbirth advocacy groups to really make that connection too, and to advocate for CMV specific research. And I mean, you guys are doing this event in DC, right?
Yeah.
I would love to see some CMV signage there.
Oh, I was going to text you. Listen, I was going to text you. We want you guys to come. We're doing a big push. See what I did there? Yeah. In October in DC, to advocate for stillbirth prevention and awareness. So, we definitely, want you guys to be involved. We do have a website. It's called thebigpushmarch.org. So
love it. I'm going to be there with a CMV sign. I am going to be there.
Our goal is to have 23,000 empty strollers rolling through DC to highlight and bring awareness to the amount of babies that are lost each year to stillbirth.
I love it. I think it's perfect. I think it's hard for people to visualize and quantify something. And when they see it, it's like, oh, and we need that for CMV too. I mean, when people hear 4,000 disabilities every year, they're like, okay, what does that mean? But when you see that number, it's huge. So I think it's great. I Oh, people can put CMV signs on their empty strollers. There you go. I mean, yeah.
Come on, bring it.
I think that's huge.
Bryn, so great, you're coming. We have an RSVP yes from Amanda. She doesn't even know the exact day, but she's in.
Yeah, I'll be there. I can't wait. And stillbirth is really important to me. I should add this. You guys. I should have said this in my introduction, but I have a baby save. When I was 34 weeks pregnant with Pippa, my CMV baby, I was getting my last cytogam infusion in the hospital. You have to be admitted to the hospital to get this infusion. And she was not moving, that little stinker. And I was in the hospital and I was sitting there thinking, I don't want to bother them. I shouldn't call them. I'm sure it's fine, right? My husband even was kind of like, oh, I'm sure it's nothing. And I called them and I said, she is not moving. And they came in and they did the non-stress test or whatever, and the biophysical profile. And they were like, she's not looking right. And she barely passed that biophysical profile. And the doc came in that morning and the doc said, hey, what's most important to me, and thank God for this doc, said, what's most important to me is that you feel like this is not normal for her. And they delivered her that day. She had a true knot in her umbilical cord. And who knows what would have happened if I hadn't spoken up and said something. So this is just a common theme. We need to speak up and say something. We need to be informed about what can happen in a pregnancy and how to protect our babies. That is so important. How can you protect your baby? And it should be empowering to you.
Right. It's not anxiety ridden. It's empowering because you're educated enough to know, and you're like a grown woman that is in charge of your own body. You can make those decisions for yourself.
Yeah. So I'm always
amazing story.
So thankful that Pippa's here.
Yes.
It could have easily gone a different way, and we're very, very, very lucky, and we know that.
Yeah. And so happy you said something, because that we hear that a lot as well. Is we kind of just like oh, I don't want to be a bother, or like I'm just kind of like being too polite, like
right. Well,
but like when something is wrong, like you trust that intuition.
In the hospital, and I still didn't want to bother them, and I was already there. Like, it's so much harder when you're at home and you know that you're calling someone in the middle of the night. Just do it.
I laugh because it's like, we also forget that we are paying them. That is the service they provide to us. And we are the ones that feel like we're being a bother or like imposing, like it's literally their job. So I mean, I say F politeness to that, like speak up, keep pushing, keep advocating for yourself. If you feel something's off, you're not crazy. Even if you are crazy, it's fine. Go get it checked out. Like, no big.
Yeah. And it's not your doctor's job to make you feel better, right? I just feel like it's your doctor's job to give you the information. And so we deal with a lot of, sometimes even like after infants are born and they fail their newborn hearing test, sometimes we hear from families who are like, well, everybody told me it wasn't a big deal. It wasn't going to be a big deal. I'm sure it's nothing. How often do we hear that? And we go against our own gut instinct that's saying something's wrong. And so it's not your job necessarily to make someone feel better. It's really your job to provide the factual information and let that person deal with it.
And make a choice, like be able to have a choice. Like that's the empowering thing. Empowerment is not shielding people from information so that they don't feel bad. It's giving them the information so that they can make informed and educated decisions. That's it.
Absolutely.
mean, we have one person. Get your last minute questions in because we're going to be wrapping up in a few minutes. One person said that they joined late. Can your small child have their saliva tested to see if they could pass it to you while pregnant? CMV testing is done by blood. So they can have their blood tested. You're better off getting tested yourself, I would say.
I would say
non-medical advice.
I would say in theory, yes, because that's how we do a lot of newborn screening is with
Spit?
saliva.
Oh, I didn't know that.
Yep. A lot of newborn screening is done with saliva because you either need to test urine, saliva, or blood. It is more accurate to do urine and saliva currently, and it is easier to collect saliva than urine. So that is why a lot of times newborn screening for CMV is done with a saliva swab. And if it's positive, they confirm it with urine.
So why wouldn't screening for women be done with saliva?
Because if it's in your saliva, it means you're shedding it. You're actively shedding it.
Okay. Okay.
So, and again, I'm not a doctor. I'm not an expert on exact CMV testing science, but I will tell you that for maternal antibodies, you have to figure out, have you had antibodies before? That's going to be a blood test. For are you actively shedding the virus?
Got it.
We can do it by urine or saliva. I would say we don't really necessarily recommend that pregnant people have their children tested. We recommend that everybody follow the same hygienic precautions. I mean, because they could be shedding it one day and then 2 days later, or not shedding it one day and then 2 days later they're shedding it. You know what I mean? I mean, I don't know how often you would check, and so it's a little tricky. We recommend the exact same precautions for everybody. The other thing that's important, and sometimes we get this question, is for people who work with kids. They say, well, should I avoid kids who have a diagnosis of congenital CMV? I want to get pregnant. Should I avoid them? The answer is no. Most kids with congenital CMV are never diagnosed. So if you are avoiding kids with that diagnosis, and then you're letting your guard down with every other kid, that's not right, because the next kid who walks into your wherever office or clinic or whatever is just as likely to be shedding CMV as the kid with congenital CMV. You are, I can't remember, it's 4 or 5 times more likely to be exposed to CMV from a child without a congenital CMV diagnosis than from a child with congenital CMV diagnosis. So all children need to be treated the same in terms of, I'm pregnant, how can I avoid CMV?
Don't finish the sandwich. Don't put their pasty in your mouth. Don't share food and drinks. Wash your hands really well. Even if you're in a rush, you just change that diaper. You're in a rush. We've all been there. Go wash your hands. Use some sanitizer, which is what my daughter calls it. It's not hand sanitizer, it's sanitizer. So now that's like in my lingo. A couple more questions. Jen, you mentioned your doctor had said your placenta showed CMV. How, what, and would a doctor or placental pathologist see or tear for CMV? So the pathology would be able to see it if it was tested for it. My doctor said that mine had spots. And so she was able to kind of visually see. And then my daughter had also had some visual spots as well that, you know, was indicative of that. Question, is CMV harmless to the toddler? They don't show any symptoms, right?
So yeah, 99.9% of the time, or I don't.
It's like a cold.
It's like a cold. They might be
at worst, right? Like,
yeah. The only people CMV is harmful to after, you know, a pregnancy are people who are immunocompromised. So they've got AIDS, they've got, you know, they're in cancer treatment, they've had a bone marrow transplant, something like that. But for the most part, very harmless. It doesn't harm other kids, so we don't need to like exclude kids with CMV or keep them from other kids. This is something most kids are going to catch, especially kids who are in daycare. Are going to catch in the first few years of life. So, and
about half of people have it by the time that they're 40 anyway, yeah. Right? It's just that other half, and then when you get it while you're pregnant.
Yeah. You know, I mean, you can
there's a primary infection, right?
Yeah, so you can have a primary infection during pregnancy, which is you've never had it before, which is in general usually the most harmful.
That's what I had.
Yep, and me too. You can be exposed to a new strain, or you can have a reactivation. And so it's tricky. Unfortunately, nothing about CMV is simple. I really wish it was. That's another thing I hear, Jen, too, though. I've heard from some docs is that, well, most people have been exposed, so most people don't have to worry about it. And I'm like, well, that's a little misleading for a couple of reasons. One, not everybody's been exposed. I mean, half, 40%, whatever it is, it's still a huge chunk of people during their pregnancy have not been exposed.
Right.
And secondly, as we've talked about, it's not just primary infection that causes disability. It's secondary infection reactivation that can cause disability as well.
Are those less likely occurrences than a primary infection?
So no, they're not. They're not less likely. I think there's a research study that I think worldwide, 2/3 of infants born with CMV are born to mothers who had CMV in the past. So a primary infection usually causes the most severe impacts, but it is not necessarily, especially when we look at it on a global scale, it is not necessarily the main driver of congenital CMV. It's both.
Well, and so this just really brings it back and ties it up in a bow from what we were talking about at the beginning of knowing before you conceive what your levels are for IgG and IgM, and then throughout your pregnancy being tested for it as well, because especially if you're at risk, right? If you're around small children or in a higher risk environment, to be able to see if that changes.
Yeah, there is some initial data and some research that if and this is not widely accepted or FDA approved yet, but there is some experimental treatment happening with oral antiviral medications that if we can catch that before it gets to the baby, maybe we can prevent that transmission from happening. But again, that's not something that most people are going to have access to because most people are never going to know that they had a CMV infection during the pregnancy.
Right.
But there's promising
being tested.
We need a lot more, we need a lot more research on treatment during pregnancy. But there is some promising initial research happening, with IV treatments, but also with this oral treatment. That seems to be the way things are going now, more than in 2015 when I had my treatment. There was
an infusion.
There wasn't really talk of oral treatment at that time for me.
Yeah. And now some of the investigational treatments, they, again, not FDA approved. They have been showing promising results, though, in immunocompromised folks. Organ transplants, it is FDA approved, I believe, for people with organ transplants to be able to limit that risk of infection. So hopefully we'll be on a good path forward for pregnant people.
Well. And also for infants. I mean, not all infants should get antiviral treatment, but some of them should, and they should talk about that with their care team. But we also really consider early intervention, hearing monitoring, vision monitoring to be treatment. So infants who have a diagnosis should have early intervention, treatment, monitoring. So we need that for during the pregnancy. We also need that for after birth.
Yeah. Be able to just set everybody up for success right off the bat. Do we want to quickly talk about vaccines?
I love this topic. A few years ago, I was kind of like, oh man, how long is this going to take, right? Like,
now it's moving so fast.
I was
okay, fact check me here because
I'll try.
I've been reading a lot of medical journals and I am not a doctor. And so I try to interpret them as best as possible. And I am relatively educated. Correct me if I'm wrong. The advancements made in the CMV vaccine via Moderna are happening faster because of the COVID vaccine. Is that right?
I would say the reverse, Jen.
The reverse.
I would
COVID
say
happened because of Moderna's advancement in CMV vaccine.
I can't speak for Moderna. I can't speak for them, but my understanding is that their work on their CMV vaccine enabled them to get their COVID vaccine out
faster,
more quickly. Because mRNA technology has been going on for years. It's not brand new. It's not like, oh, they came up with that when COVID came out. No, they've been working on a CMV mRNA vaccine for quite a while. And so, but I do think, after their success with the COVID vaccine, that has enabled them to put even more, resources into all these other vaccines that they're working on, which CMV should be the next one knock on wood.
Well, they're in phase 3 now. They're
in
recruiting for phase 3.
People, please log on to the Moderna site and see if you're eligible.
Please.
I think you have to be, don't quote, well, you can quote me, I guess. Do your own research, check the website, but I think you have to be like around children enough that you're at risk for catching it. And I think you can't be pregnant or breastfeeding. But other than that, I mean, yes, get out there. That's another thing people.
They're recruiting 8,000 women in the U.S. for it.
So huge. We're hoping in the next, I mean, I would hope in the next few years that this CMV can become like rubella. It really can, you guys. We don't
love you so much. I hope you are out of a job.
Yes, totally. I would love to be out of a job. I can go back to what I was doing before, but we don't even think about congenital rubella, you guys. And the people on this call are probably like, okay, what's that? When your kid gets the MMR vaccine, the R in that is rubella. And one of the main reasons we vaccinate little kids for that is so that when they grow up and have children, they won't have to worry about rubella. Congenital rubella syndrome used to cause the same kinds of disabilities that we see in congenital CMV, and we don't see it anymore, hardly ever, because most people have been vaccinated. So it would be great. It would be so great if we could do the same thing for CMV.
We did get a question about the vaccine. Is it for women who have not had CMV? I just sent, we'll put the link in the chat so you can go check out their clinical trial recruitment and see your criteria for inclusion or exclusion. But I can just read it really quick. Woman between 16 and 40 years of age, you have to be in good health. You have to be in close contact with at least one child 5 years of age or younger for at least 8 hours a week. And you cannot be pregnant or planning to become pregnant within the next 9 months. There's a few other things in there, so make sure you go and check out and see if you're eligible, and please participate.
Yeah, and I would say if that question is asking, you know, once the vaccine is hopefully licensed, who is that target audience? It's going to be for all people before they have a pregnancy. So, and I do not think that there's any plan to test people. Have you had CMV? Have you not had CMV? I think that the idea of the vaccine is to prevent, you know, other strains, a reinfection, you know, all those different things. So I don't think that they'll be checking your antibodies to decide if you should get the vaccine or not. I think it will be, hopefully it will be recommended for all people before they have a pregnancy.
Well, that interpretation of the question made way more sense than my interpretation.
Okay.
Any final words? We're a little bit over time, so we can wrap it up, but this is an awesome conversation with you. Any final words, Amanda?
No, I would just say thanks so much for having us. Thanks for recognizing that CMV causes stillbirth and for putting that out there. We are really looking forward to you know, the event in October, and hopefully hooking back up with you guys in October for even more awareness about CMV. So just thank you so much for spreading the word, and we appreciate it.
Of course. And thank you everybody for joining in. I hope this week and this Facebook Live was informative and educational. Go knock down somebody's doors, get CMV on the radar, get stillbirth on the radar, start helping to pass legislation, sign up for the vaccine trial, please. We just want to end this. We want Amanda to not have a job anymore. Yes. We want me to shut up. I would be okay with that. So please go see if you qualify. And thanks. Good night and have a good weekend, everybody.